Hey everybody, Dr. Redcross here. Now, I recognize that there's a lot of different pain points that take place when you're seeing your doctor, or at least what a lot of people have, me at least. And one of the bigger pain points, or let's say one pain point, I'll share a bunch of other ones, is why do I feel like my doctor is dismissing my symptoms? So, look, that is a big challenge and a big issue in healthcare. A lot of it is because healthcare has changed a lot. Healthcare, in my eyes, is not focused on the most important person in the room, which is you. It shouldn't be based on the dollars. It shouldn't be based on the volume and that sort of thing. And so, when you feel like you're being dismissed by your doctor, I think one of the bigger things to recognize is, I promise under most circumstances, you're really not being dismissed. I just think that that doctor or provider at that time has so much that's going on in their mind as they're trying to balance the electronic medical record. They're trying to balance all of the calls that come in while they're seeing you. They're trying to balance all of the completion of their charts and things that really have to take place in order for us to get through our days and to be able to get home to our families as well. But I will say this, while the majority of docs are not trying to dismiss you, some of my colleagues may not necessarily be, I wanted to say people, which is crazy, right? When you think you're going into medicine, but some are just different. I just happen to have a different personality where I just love to talk, hence I'm talking to you guys today. But sometimes other docs have other things going on. And so if you get to those situations when you're with those doctors and you really feel you're being dismissed and you're like, Dr. Redcross, no, I'm being dismissed. The easy thing is always to say, all right, you need to get out of there and find yourself another doctor. But it's also a point for you to stand up as a patient and really, look them square in the eyes and say, hold on now, I need to understand this better. I don't feel that you're really taking my symptoms at face value for what's going on. In other words, I just want to make sure that you're an advocate for yourself. There's nothing wrong with you standing up to the doctor and just being open and honest. Sometimes if a doctor doesn't know or recognize this little moment where you kind of take him or her to the side and say, hold on a moment, like, what's going on here? I don't feel like we're seeing eye to eye. It really changed the whole patient-doctor relationship. But when you are convinced that you're being dismissed and so forth, the other thing I want you to think about is, okay, this is likely not going to be the doctor for me, but what can I do for my next doctor or for my next interaction to make sure this doesn't happen? I think one of them is making sure that when you come to your appointment that you have a little bit of an idea about what kind of doctor you want to have when you come into the room with them. Sometimes if you're my younger patients I talk to, they don't have time for all of this. They just want to come in, doc, I want you to help me feel better and get out of Dodge. And then I have my older patients where, talking is important. Connecting is, in fact, important with them as well. And so if you're on one side of this spectrum and on the other side of the spectrum, think about what sort of doctor you want. Do you just want a doc that will, be able to just take care of your needs and get out? Or do you want someone that you really want to build, a bit of a rapport with, like it matters to you when you go to the doctor's office? So if you are feeling that your doctor is dismissing you, not taking your challenges or complaints seriously, there are a lot of things that you can do, and I just didn't want this particular patient to feel helpless. So, me, I'm always going to go kind of positive at first. So the first thing I say is, maybe the doctor doesn't know, maybe the doctor has some things going on, and in the middle of that, you got to kind of let them know. Then on the other side, some docs may not be doing what they should do to make you feel as welcome and heard. And those are the ones that you have to kind of shift gears and find someone for you. But before you shift gears, above all, make sure that you identify what's important to you and kind of what doc you want to have. to help you on your health and healing journey.
So I wrote 2 books. My first book, Bond, is about the importance of trust, respect, empathy, communication with your doctor. But guess what? I wrote a second book. This is the 15-minute Bond Blueprint. This lets you know what to do minute by minute in your 15-minute visit to make sure you get everything that you deserve.